Since 9 March 2020, the first case fund in Panama, the government had took series actions to prevent COVID-19 pandemic, emergent state, close the boundary, curfew, lockdown, stay at home, suspend the airline, suspend the companies and schools. The daily cases number is stable between 100-200, up to date 19 April 2020, the total infected cases are 4,467, death toll 126, cured 165. Let's learn some lessons from countries and try to find an effective way for prevention.
Across the globe, we have seen nations approach this crisis in varying ways. While most have decided to lock down and shut down large sectors of the economy, some are taking a bit of a different tack. So tonight we wanted to take a look at two of those nations, Sweden, which you could say is lockdown light, and Germany, which has invested heavily in testing. Both nations are relying heavily on their citizens to act responsibly. So how are they doing?
Remember this? Going out, eating, drinking, socializing? Well, in Sweden, they're still doing it, albeit at a safe distance. Unlike all of its European neighbours, Swedish policy is lockdown light. Citizens can still mostly go about their lives, the government entrusting its people to just use common sense.
The difference in shopping right now is that I have to remind myself to keep distance, which I'm not really good at, but I'm trying.
To communities across America battling this invisible enemy, these scenes may seem unbelievable, dangerous even. But the Swedes have a very different approach. From the outset, the authorities trusted the people to do the right thing and have tried to keep life as normal as possible in abnormal times.
The tradition in Sweden when it comes to healthcare and public health has very much to work with voluntary measures, to have a dialogue with our population, to give good advice and tell people what we're trying to achieve, not telling them exactly what you should do in every situation.
Frederick and Annika have two young children. They both support the government's policy.
I think that it's impossible to keep people locked down for a long period of time, and everything points to the fact that this is not going to be over in a couple of weeks.
But it doesn't mean there are no impacts. In Stockholm, it means Annika's 7th and 8th grade students come to school once or twice a week.
The students really miss school. They love to be in school when they are. It's kind of hard for them to cope with distance learning since they haven't been doing that before, really. Då ska vi titta lite grann på realismen idag.
But her children's preschool is still open daily. And gatherings are still permitted, with caution.
We're not really hanging out, we're not having dinners. We actually went to an outdoor birthday party last weekend. And that was with the kids that our kids normally see at preschool.
The Swedes are still partaking in simple activities the rest of us may have taken for granted before the virus consumed and changed us. And they're doing so in part because of trust.
I do have a lot of faith in my government. I thought in the beginning that it was like kind of lame behavior, but I think that it seems to work. So I think it's good that we can live as we used to.
Infections are inevitable, so the Swedes set guidelines like banning gatherings of more than 50 people to try to keep the public safe without upending their lives or their economy, hoping that when they emerge from this, their economy is in much better shape than those who've embraced a total lockdown.
I think we're all using high-risk approaches these days. Closing down society is definitely a high-risk approach. We believe that the slow spread of the virus, while the healthcare keeps on working, while society is still in a fairly normal situation, is the best way to run this.
But the Swedes may have made a catastrophically bad move. The latest numbers show that Sweden's death rate is double that of its Nordic neighbours who embraced a full lockdown. And despite the effort, a recession may be unavoidable, according to the IMF, as the death mounts across Europe and the critics of the laid-back policies are now asking for tougher measures. Germany's also been an outlier, but for very different reasons.
Our country has not seen such measures before, and they will, of course, be severe, but they are currently necessary to reduce the number of contacts and thereby the number of infections and severe cases in order to make sure our health system is able to cope.
Methodical and organised, they've been extensively testing, tracking and isolating cases.
We have some basic conditions that make Germany maybe more resilient to such a situation. And I would think that one of those is the big testing capacity. Another one is a very strong health system.
The testing, a stark contrast from the UK, which was slow to shut down. On the week of March 16th, as Italy reached its apex, the virus had already claimed thousands of lives there. Hundreds of thousands had already been infected. And days later, Prime Minister Johnson only just officially ordered a nationwide lockdown, a move Italy had taken weeks prior.
I don't understand why the government didn't decide in time to protect the citizens.
And now the UK's death rate has reached over 11,000. Even though Germany is more populated than the UK and had one of the first European clusters, their reported number of deaths is strikingly low, just above 3,000. While Germany's imposed restrictions on movements and gatherings, they've been less stringent than other European countries. And much like Sweden, many people understand it's just their civic duty to protect others.
I think each person decides for him or herself if he or she needs to go out and have a walk or get some sun. I think it's nice to have some sort of freedom. Still, it's important to be conscious and stay home for the sake of the health of many people.
Around the world, countries are grappling with the balance between lockdown, liberty and preserving economic life. Everyone will be looking very closely at these European exceptions, desperate to learn lessons.
I think European countries are desperate to try and get back to business in some way that they can. China has tried this.
The lesson given by China is, lockdown and quarantine, testing more as you can, build cabinet hospital and admit and cure more patients as you can. Then the infected cure became flattening, consequently China reopened the economy step by step, meanwhile using app tracing the person cured or infected. Along with Wuhan reopened, more and more cities left restriction, the industry capacity recovered and produced more protection equipment to help other countries.
Seguro que enviará al país vecino suministros contra la epidemia, incluyendo conjuntos de trajes protectores, 100.000 mascarillas, a suministrar bienes médicos y enviar profesionales a Italia. La semana pasada, doctores del hospital Tsuinji de Wuhan, epicentro de...
Diplomatic tensions have been put aside for now as South Korea, China and Japan pledge greater cooperation to fight coronavirus. Boxes of protective equipment donated by the Chinese government arrived in South Korea to be sent to vulnerable communities. On Friday, the foreign ministers from the three countries spoke via video link.
I'm sure we all agree that we need to think about ways to prevent the spread of the coronavirus, as well as the need to minimize the economic and social impacts caused by the decrease of exchanges between our people due to this incident.
Just weeks ago, South Korea had the highest number of coronavirus cases outside China. Now the situation appears to be stabilizing, and the number of new cases being recorded is trending downwards. But there is no sense of complacency in South Korea. In fact, the government is introducing stricter border controls.
As of midnight on March 22nd, we will conduct testing for all people entering South Korea from European countries, and especially for a long-term stay. People will be required to self-isolate or should be sent to an isolation facility for 14 days.
This is Shibuya, right in the heart of Tokyo, one of the busiest intersections in the world. And you can see there are lots of people out. Some people are wearing masks, some aren't, but I mean, this place is absolutely ram-packed right in the heart of this coronavirus crisis. Now, things are starting to change here. It's getting harder to find masks, hand sanitizer, those sort of things. 12 million kids aren't going to school for probably the next month, but it's not like in other cities where there are really pretty tough restrictions. Beijing, where you can't sit down at a restaurant with more than 3 people, where they're really trying to contain the spread of the virus. And with the Olympics coming up, some people are starting to wonder whether they're doing enough here. So yeah, Shibuya on a Saturday night.
So it's Sunday morning in Tokyo, and we're about to head out onto the street and see what ordinary weekend life is like here since the government started recommending that people stay away from large groups and avoid the subway and that sort of thing. And because we're going to be out for a little while, I normally wouldn't wear a mask here, but we're going to be in the subway. We're going to be around lots of crowds. So for social reasons and a little bit of protection, I'm just going to put this mask on. So here we go. On our way. So it's noon on a Sunday. I'm supposed to keep my voice down. That's kind of the protocol on the subway, but this is what it looks like. Quite a few people, actually.
Corona. Yeah.
It's about 1 o'clock on Sunday in Tokyo in Yoyogi Park. You can see a wedding going through this temple. It's incredible. All in traditional dress, not wearing masks. They're taking family photos right back there. I think there's another one coming right after them. Clearly, daily life is continuing. First cherry blossoms of the season, and everyone's out taking pictures. The thing about these masks is when it's hot outside or even warm outside, they can get really sweaty and misty. Sometimes you just need a break. It's 1 o'clock in the afternoon in Tokyo on Monday, and we're in a taxi heading back to the airport because we're going back to South Korea.
Countries around the world have shut down to curb the spread of the coronavirus. But in South Korea, people are starting to come back out on the streets. Starting in late February, South Korea was reporting a sharp increase in coronavirus cases. With over 5,000 infected, they were registering some of the highest numbers of confirmed cases in the world. But then something changed. While cases in most other countries continued to rise, Korea's numbers started leveling off. Look at how this curve starts to bend. It indicates that Korea managed to contain the spread of the virus early on. And they were able to do it because they learned a valuable lesson a few years ago, when they fought a different coronavirus outbreak.
In South Korea, the Middle East respiratory syndrome,
the death toll on the rise, aggressively trying to contain the deadly outbreak.
The government was caught completely off guard.
Authorities are still trying to track down and isolate anyone who may have been exposed.
In 2015, a Korean businessman returning from the Middle East developed a fever, a cough, and eventually pneumonia. He went to several health facilities for a diagnosis before finally testing positive for MERS, or Middle East Respiratory Syndrome, caused by a coronavirus. By that point, his movements had created a chain of transmission that became hard for officials to trace. They didn't know who was infected or where they had been.
It lasted less than 2 months, but it was a big panic in South Korea.
Altogether, the virus infected 186 people and killed 38 in South Korea, the highest of anywhere outside of the Middle East. The government declared an end to the outbreak in 2015.
Citizens can relax. The virus no longer poses a threat.
But they didn't stop planning.
We got many lessons learned, the importance of the diagnostic test, and we need basic infection prevention measures.
The lessons all came into play when the next outbreak took hold in the country. On December 31st, 2019, China reported the first case of the coronavirus. In the following weeks, as the outbreak started spreading across the world, South Korea only had 30 confirmed cases of the virus. But despite the low numbers, health authorities had already started working with biotech companies to develop a test for the novel coronavirus. And soon, they had thousands of test kits ready to go.
Lesson learned from MERS outbreak in 2015. First one is the diagnosis test is very essential. We developed a lot of diagnosis tests and distribute in every hospital.
They prepared for the worst, and the worst quickly followed. By late February, the total number of coronavirus cases rose dramatically, crossing 3,000. This made South Korea's outbreak the largest outside of mainland China. And it all started here, in Daegu, where a woman went to the hospital with a fever. Because the government had already equipped hospitals with coronavirus tests, doctors were able to test her. She tested positive and became known as Patient 31. But the testing didn't stop there. While she was sick, Patient 31 had gone to a megachurch where she sat with a congregation of hundreds for more than an hour. So they traced her movements, identified people she had come into contact with, and then tested those people as well, whether they showed symptoms or not. Many of them also tested positive, so they were quickly isolated and treated at home or at a center. And then all the people they had been in contact with were traced and tested too. This is called contact tracing. It's an approach that allowed Korea to test over 9,000 people who had been in contact with someone who had tested positive. After Daegu, Korea ramped up testing around the country. Private and national healthcare systems joined forces to set up a mostly free testing effort that includes more than 600 locations that screen as many as 20,000 people per day. Through this system, when anyone tests positive, the government is able to test and trace their contacts to continue to break the transmission chains of the coronavirus on a large scale. But that's just the human-to-human transmission. The infected person may have moved through the city, touching subway poles and door handles. And South Korea had prepared for this too. After the MERS outbreak, when they weren't able to trace the movements of the virus, Korea changed the law, allowing the government to collect a patient's data and security footage during an outbreak. All their steps are logged and then shared to alert people to stay away from the path of infection.
If there is some confirmed case found near my office, they message via smartphone, there is a confirmed case near your place. He moved some place to another place. Be cautious.
Websites and private apps compile that information, allowing everyone to see if a person with a confirmed case of coronavirus went to a pharmacy or the hospital or anywhere else. And they'll know how recently they went too.
It's a means of checking the possibility of infection.
Citizens are checking the coronavirus locations and are avoiding going to these areas.
This information lets people know if they've crossed paths with an infected person, so they can go get tested for the virus. And contact tracing starts all over again. Tracing people's every move can be controversial, but many in South Korea prioritize public health over privacy in an outbreak.
남에게 전염시켜줄 수 있다는 그런 특성 때문에 개인의 인권보다는 공익적인 그런 요인에 대한 걸 많이 강조하는 그런 경향이 있는 건 사실입니다.
As a result, South Korea was able to test hundreds of thousands of people, more than any other country at the time. And this made it easier for authorities to see the virus, to see where it's located and where it may be lurking. This ability to find and treat infected people has allowed Korea to avoid aggressive lockdowns. And it's helped bend the curve of the outbreak that started out dangerously steep. For now, Korea has turned a corner, but they continue to be prepared.
We are very cautious to prevent the second wave. Every day is the kind of state of war.
It's that kind of vigilance that has set Korea apart in the coronavirus pandemic. But it wasn't the only place to test people aggressively. Singapore, Taiwan, and other neighbors saw the benefits of widespread testing too. Now countries like Germany and the UK are starting to implement aggressive testing, and even the US, where the government has failed to provide adequate testing, is now scrambling to test more people.
We know that we have to do more, and we continue to accelerate in testing.
Korea's strategy of contact tracing might not be easy to replicate in countries with much larger populations. But the country's success with widespread testing still offers a way out for most countries that are stuck in lockdowns.
Today, I'm instructing my administration
The U.S. seems to take a different strategy. They focus on the testing. Over 2 million people were tested. They produce ventilators to save life due to the high death roll. Now U.S. became the king of ventilator, as President Trump said, but his controversy words really confused people, so they were keeping arguing and blaming, which was as weird seen under the epidemic cloud.
This was the same president who posted this back in February, and we quote, "The coronavirus is very much under control. In the USA, we are in contact with everyone and all relevant countries. CDC and World Health have been working hard and very smart." In recent weeks, Trump has hinted he's eager to reopen at least parts of our country as soon as he possibly can, despite the risks that are obvious to us all. Tonight, the Washington Post reports one team of government officials. It's being led by FEMA and the Centers for Disease.
Today and yesterday.
They said, I acted late on closing down the country. Some people wish we never closed it down. Now, if we didn't, we would have lost hundreds of thousands of people. You know, interestingly, so I'm against it. We did the right thing. Everything we did was right.
Decisively or correctly in every case involving the virus. Here are the receipts. That thorough New York Times investigation finding the president was slow to absorb the scale of the risk and the warnings from senior officials. Now, today, his new claims that the WHO was wrong, late, and China-centric, those are misleading, and they are contradicted by Donald Trump himself.
Are you concerned that China is covering up the full extent of coronavirus?
No, China's working very hard. Late last night, I had a very good talk with President Xi, and we talked mostly about the coronavirus. They're working really hard, and I think they're doing a very professional job. They're in touch with our World Organization, CDC also. We're working together, but World Health is working with them.
World Health is working with them. That's what the president sounded like in real time. Today, he's criticizing the World Health Organization for saying at that time that he was praising them and China, they weren't doing the right things. Now, that's Donald Trump's own record. We also know what life was like just a few months ago. Everyone remembers it. Trump was downplaying the threat, and the presidential primaries were in full bloom. People were living normal life in America, but now we know behind the scenes.
Day 1187 of the Trump administration, just 197 days to go now until our presidential election. In fact, the president talked about the election today. He said the following, quote, "I think we're going to win in a landslide because, quote, a lot of people love Trump. A lot of people love me." He said, quote, "If I wasn't elected, maybe the world would be over."
The world would be over. It seems to be a way to save world. Panama found the first case on 9th of March 2020. The government took confirmative actions to prevent pandemic, national emergency, close the border, suspend the airline, curfew, lockdown, suspend the companies. The cases curve became flattening and stable. The latest data is 5,166 cases, 146 death and 271 cured. The government planned to lift the restriction and reopen economy gradually.
Que vamos a necesitar en infraestructuras públicas para poder generar empleo. Eso es sumamente importante. Ya se tienen, obviamente el primero que estoy viendo aquí es el tema del cuarto puente sobre el canal.